stick her finger right into my butthole. I felt a bit.
Seek help early. Colon cancer is still very treatable.
Yeah, I mean, like, you know, the superstar Chadwick Boseman. He died of colon cancer, right? And my name is Joshua David Samsriwi, and I am your host for this amazing podcast.
And I am Dr. Tony Setiobudi. I'm the co-host for Dr. Sewan Horh. We will chit-chat with doctors, experts, specialists in their area. We will give you the best information that is reliable and trustworthy.
And so subscribe, and we know that these videos are gonna speak to your heart. God bless you. Dr. Sewan Horh, not I Sewan. Anyways, doctor. Yeah, so actually, you know, like, I just was talking to my friend recently, right? He had some issue also when he was trying to go to the toilet, and
What's the problem?
he told me like he was doing some weightlifting training, and suddenly when he shit, when he 大便 or 帮晒, some blood coming out from his stool, from his
Pangsai.
got blood one. Then how?
I think we should find a pangsai doctor.
Hey, so this is Dr. KC, is it? This is the one that you were talking about?
Yes, Dr. Casey. Yes.
Hello.
Oh,
Hi, nice to meet
hey,
you.
doctor, good to see you.
To see you again.
What does KC stand for?
KC actually is my nickname.
Nickname.
Yes.
Nickname.
My full name is actually Kuok Chung in Chinese.
Oh.
But Chinese name, as usual, hard to pronounce, confusing. So I just KC.
Who say it's confusing? Can I say it again? Say it again. Say it
Kuok
again.
Chung.
Kuok Chung.
Yeah.
That's easy.
Kuok
man.
Chung, yeah. I love Kuok Chung. All right, doctor. Yeah, so are you local Singaporean, by the way?
Actually, I'm not.
Not local
Yeah.
Singaporean. Wait, let me guess.
Yes.
I think he's from Indonesia.
I think he is from Thailand.
Thailand. Oh, you're from
What do you
Thailand.
think?
Are
Sawadika.
you from Thailand? Thailand. Okay.
Close.
Okay.
Yeah, so I guess you should put a chulalongkorn at the back of the name.
That's right. You can
Right?
put that.
You put it in the back of the name. Come on, don't lie to us.
okay.
Tell us where
Actually,
you're from.
Actually, I'm from Malaysia.
Malaysia.
Malaysia boleh.
Malaysia.
Wow, just our neighbor, right?
Yes, neighboring.
Yeah. Hey, Malaysians, we love you, and one day we will come to you. All right. Yeah. So you are the doctor for.
I'm a colorectal specialist, but I'm a shit doctor. I see shit every day.
Bangsai doctor.
Yes.
Right.
Wow, doctor. So you are side name Tapian?
So you can call me something like that. Tapian. Tapian specialist.
Tapian specialist.
Tapian
DB
specialist.
specialist. Hey, in fact, when did you come to Singapore?
I come here since medical school, so it's been quite a while since I've been here.
Do you come here when you were in medical school, doctor?
I was not here.
You
Not in
were-
medical school in Australia.
You were in Australia?
Yeah.
Oh, that's fair income. Awesome. Which school do you go to?
NUS.
NUS. Wow. Then that is good. I was supposed to go to NUS medicine school, but they didn't accept me. So,
No.
hey NUS, I think I rethink your decisions.
You should retake him.
You missed a huge talent like me. You
Yeah.
missed it. Yeah. Didn't nail it. All right, anyways. Yeah, doctor. So we all got a bright future, right? Don't we? Yeah. Yeah, Dr. Tony, what do you have to say?
Yes. No. I saw a patient referred to me for back pain, but the patient also referred to general surgeon for piles. And I asked the patient, he likes to do weight. I'm just wondering whether weight can cause piles. What do you think?
You mean weightlifting?
Weightlifting,
Oh,
sorry.
weightlifting.
Weightlifting,
So
yeah.
weightlifting can cause piles. What?
Piles.
What is the name?
Piles was piles.
Pillars.
Yeah, what's piles?
You mean pulse?
Oh,
what
yeah.
What is the name for it?
In medical term, we call it hemorrhoids.
Hemo what?
Hemorrhoids.
Hemo what?
Hemorrhoids.
Hemorrhoid?
Hemorrhoids.
Oh, hemorrhoid. Yes. So we
Hey.
talk about hemorrhoid. So weightlifting, can it cause hemorrhoid?
It's confusing to pronounce, but usually we just call it pulse. Or
Yeah.
Okay.
in Chinese, we call it Sichuan. Or
Sichuan?
Bahasa, we just call it Buase.
Ways.
Yeah.
No bahasa.
Oh, ways.
Yeah, easier.
You're flexing your bahasa there. Ways. I don't even know what it means.
Wasir.
Was it? Yeah.
I was born in Indonesia, by the way, but I don't know what he's talking about. Sorry. Yeah. So,
Is
can-
pulse actually normal structure or?
Actually, pulse is all of us got pulse. It's a normal structure in the anus. Everyone got pulse. It's what we call it a cushion there, basically. No, our near anus or this tissue with a lot of blood vessels. There is a function to this pulse. The function is help us to maintain our continence, so that we can pass motion. We know when it's a shit coming out or when you want to fart. So that you see someone your love in front of you don't want to fart, right? They
You need
tell
your
you that
pulse.
you need
You
your
need your
pulse. It says
pulse.
that gas coming out, you faster squeeze your bum, then it cannot come out.
Yes.
Yeah,
wait,
that's a-
wait. So means that your pulse is a body part.
Yes, it's a normal body
It's
parts.
a body part.
Yes, it's a
and
normal
then
parts.
your hemorrhoid is the name of the disease.
When you got problems with it, then we call it hemorrhoids.
Oh, okay,
So
okay.
if I say I have pulse, means normal pulse or?
Usually, when people say they got pulse, means they got problem with it. Otherwise, they wouldn't
Okay,
realize
okay.
they got such problem.
Oh, okay,
Yeah.
okay. So can weightlifting, do like heavy exercise? Can it cause? Like, can it be a cause and effect kind of thing there?
I mean, exercising or weightlifting per se, if you do it proper technique, it wouldn't really cause pulse. But if poor techniques, it may cause pulse. Or if you already got predisposing pulse, it may make it worse.
Okay.
Yeah.
I mean, what do you mean by a wrong technique? Like, for
Yeah.
example, do I do my deadlift? I lift it up too wrongly, or what?
I mean,
what do you call?
I don't carry weights myself. Can see no muscle, right? so in terms of technique wise, I don't know the details, but anything pulse, one of the main risk factors is increase in pressure. Pressure in the
Abdominal pressure.
abdominal pressure, in the lower abdomen pressure. So
okay.
anything we do that increase that pressure, be it like coughing, straining, squatting, all this increase pressure. So your weightlifting, if you focus your pressure a bit more towards the lower part of the abdomen, it may make the risk go up higher.
Oh, like so, like if you feel pressure, you pressure your body,
Right, pressure.
like
yes.
any sort of pressure,
Yes.
physical
It's a-
pressure,
Yes.
mental pressure as well.
Mental, no.
No, not mental.
It's the same thing like people got what they call hernia. No, hernia?
Hernia,
Yeah,
yeah.
same thing. The way
I've not heard of it.
weightlifting, they wear the hernia belt, correct? To prevent hernia
Oh,
with pressure. So,
I see.
Is there any
Yeah.
pulse belt?
unfortunately,
No
Maybe
pulse
we can put a butt plug.
What are you saying? Anyways, by the way, when I was serving my national service, right? Actually, there was a moment where we had this thing called field camp, right? You know field camp? Like field camp is when we have to stay like about a week in the jungle, and we couldn't. And obviously, when you're having field camp, you may not have the mood, or even the time sometimes to go and pass motion. Because I mean, you gotta dig a hole, man, and you gotta fill up that hole with the soil to cover your shit, right? And so sometimes it's a bit, not so user friendly. Perhaps you can say that way. And then like I heard of stories whereby the recruits came back and then they had bleeding in their motion when they pass motion, and then there is pulse, right? They have blood in their stool, and
Not
so
always, right?
sorry?
Not always pulse. It can be other thing.
Yeah, it can be other things sometimes.
But then I remember that day when I was serving NS, they call it pulse. That was what I know about pulse, and maybe it's a good time to ask you as well. Like, what can NS training actually cause that? Like, somebody they don't pass motion for days,
I mean, most common cause of the bleeding is still bleeding from the pulse. What happens is if we don't shit,
Oh, okay.
our shit become
Hard.
hardened because it stays in your bowel. And
Oh.
if you're NS, you're sweating, you don't drink enough water, then your body will absorb more water. It make your motion become even harder. Then your stool become imagine rock hard. Then you use a rock to rub your skin. It will cause abrasion, correct?
Okay.
So in your anus, the skin that even smoother in your face.
Oh.
Yeah, so you rub it, you will bleed.
So-
That's what happened.
So
Oh,
we can
Here.
ask you about that.
Yes, you can
Oh,
ask
yeah,
me about
this
yes.
funny
So-
thing, yeah.
Yeah.
If the
Imagine-
stool, this
Ah.
is what is this actually?
So this is what we call the rectum, the lowest part of our
This one.
bowel.
This
Yeah.
portion.
Rectum.
Okay.
Then this is the anus.
Okay.
Main we call it your asshole.
Oh,
Asshole
this
is here.
is
Asshole.
Asshole.
this is the
Yes, yes.
asshole.
Yes,
Is
asshole.
this this long?
Yeah.
just this long, or can
depends.
does it go bigger?
It can be flexible.
Is this-
It can be flexible.
Is this a real size?
Real size usually
Real
a
size?
bit smaller. This is
Smaller.
too loose. Too loose.
This is too loose already. This is too loose.
Yeah,
so
it's too loose.
so one finger is too loose.
Usually just very snug one finger. This is loose.
Yeah. Okay. I think that is
yeah.
too much fingering for.
much-
for
yeah,
that.
too much
Yeah,
fingering.
but that's much fingering.
Okay.
X-rated stuff. X-rated stuff.
Okay. So yeah.
Yeah.
Can I ask you which one is the pulse?
So pulse, you see this bluish thing?
Oh.
This is pulse.
Not
this
not
part.
this one.
That
So
is
the
that is-
pulse is around at the what we call the junction between the anus and the outer skin here. this
Okay.
area.
Okay.
Is it really blue? In the real life?
Usually it may look a bit bluish or sometimes it may be a bit red because it's filled with blood vessels.
I see.
Yeah.
I think everywhere in the body is blood vessels, right?
Yes. Yeah. The
Like
set here skin is
everything.
very thin, so it's very prominent, the blood vessels.
So if
Right.
you have hard stools and rubbing against the pulse,
Right against this, you'll bleed.
Oh, so that's what caused the.
The
Did
bleeding.
you call it abrasion?
In a way, it causes abrasion.
Yeah.
Then after that, it will cause because once you got cut, the vessel will bleed a lot.
Yeah.
Then after you finish it,
Yeah.
your anus closes, right? You have to hold it so no more bleeding.
Oh.
Yeah.
what about if the poo is big in diameter?
That's why big, it come out, you crack. So the other thing sometimes may happen is big shit come down, your anus, usually anus, the whole lobang small, right? Sudden stretch open, it may cause a tear.
Yeah.
A tear. See this thing? Here, there's a tear. This thing we call it, medical term, we call it anal fissure. Meaning it's a
Right.
cut at the anus.
Anal fissure.
Fissure.
Oh, fissure.
So now
Fissure.
earthquake or
Okay.
fissure, right?
Okay.
Online, same thing.
Okay.
That is
It's a
different from pulse.
Different from pulse.
How do you tell if it is the bleeding from pulse
So-
or from fissure?
Good question. So bleeding, hard to tell. Is it from pulse or is it from fissure?
Okay.
Usually from fissure, the classical symptoms patient may experience is after the pass motion or after pangsai, they feel pain because there's a tear there. They feel like something burning at the
It's like an
asshole.
open wound, right?
Open wound,
An open
burning,
wound, something touching the
raw,
open wound,
correct, raw
right?
pain sensation.
You feel
Yeah.
a crack like that.
Yeah, you feel pain at anus for the next half an hour, like that. Then after
Yeah.
that, you get better. Then no more
Yeah.
symptoms. As for pulse bleeding, most of the time, not much
Painless.
pain.
Oh, okay. Okay.
Yeah.
Actually, talking about that, talking about open wounds, another like, side thing that I have to ask actually, like how often, like just for general doctor knowledge, right? How often does open wound turn into an infection?
For open wound infection, usually for wound,
And like any
Let's
wounds,
say,
like any wounds.
let's
yeah.
say fissure,
Uh.
and those areas are dirty, about shit every day.
Can it turn into an infection?
fortunately, even our anus is very dirty. It's
Yeah.
very resilient. It won't get infection so easily.
Oh,
So sign of infection is when they have persistent pain,
Okay.
even though they're not going to toilet.
Okay.
Continuous pain, pain worsen.
I see.
They can't sit properly.
I see.
May have fever. These are signs of infection. In terms of duration, is hard to tell.
But any like normal skin wound, right? Right? Can it cause like how often does it turn into an infection?
How often? Usually you keep it clean. Most of the time, risk of infection is low, especially just a very mild superficial cut.
I think some of our viewers were actually wondering as well. How is it that possible that more like perhaps when should you actually consult a doctor? Before you go on or continue with your exercise routine. If let's say you
got
suspect, that-
Bleeding, right?
yeah, some bleeding.
You got
Yeah.
bleeding
I mean,
redness.
usually if you got bleeding,
From anywhere, like from any exercise,
yes,
you
for
can-
any exercise, one, it depends on your age. If you are someone that is older, we would say probably 40 plus above, always we worry end of the day, is there any other cause besides pulse? Because pulse is common.
Okay.
All of us may have some bleeding, some pain in our
Okay.
life. All right.
Okay.
So you continue to bleed a bit, then better go and see a doctor. Make sure
Okay.
that you get screened. It's not like colon cancer, which is quite common.
Quite common.
Yes, one of the most common cancer.
Colon
around the world.
cancer.
Colon cancer.
This is
Or
very,
we
very
call
common, is it?
Colorectal cancer.
If you have bleed from the anus,
Yeah.
what is the chance if you are 40, let's say?
That
What
is
is the
colon
chance
cancer.
that it is colon cancer
Yeah.
caused by colon cancer?
The chance actually is still pretty low. So don't need get panic once you see blood.
Like, what is the
rough
statistic?
numbers.
Statistics will say that probably I would say less than 2%.
Less than 2%.
Wow.
Right? Not high because in terms population,
What about pulse? Caused by pulse?
caused by pulse usually I can see that
98%.
probably is still around there. Highest cause of bleeding is fresh blood usually we ask a bit more about the characteristic of the blood. People say this, I got blood in the stool. We will ask, drill into details. We ask things like, hey, your blood, what's the color? Is it fresh red color? Is it darker color? Is it mixed with the stool? Or is just at the end dripping? So all these things help us to gauge roughly is the bleeding. Is it from the pulse or from something else we are a bit more concerned about? Yeah, so it's not so simple. It's like bleeding equals to pulse.
Okay, but I mean, to put it simply for our viewers, it's like basically colon cancer is not a common occurrence. Is that what we're saying?
It's not very common, but it's something we are concerned about.
Okay.
Can be serious if it is
can be
untreated,
serious,
but not
correct.
common.
Yeah, so seek help early and we treat it early because early colon cancer is still very treatable.
I mean,
there's a myth that people get cancer equals to death.
Yeah, I mean, like, the superstar Chadwick Boseman,
Yes.
the one who played Black Panther, right?
Yes.
Wakanda Forever. Right? You know the one who did that?
Yeah.
He died of colon cancer, right? He passed away due to colon cancer.
Unfortunately, because he got the cancer found at a later stage.
Oh,
Yeah.
I see. That is such a pity. Rest in power, King.
Yeah.
Rest in power. What can food, like eating, like a lot of like barbecue meat, like yakiniku, stuff like that, does that cause colon cancer? Or is it at least,
It's known that meat, especially like processed meat, higher risk of developing colon cancer or any cancers. So we'll say can eat, but eat in moderation. Otherwise, we ask everyone to be vegetarian.
That is what
we
the
also don't want
HPB always say.
And vegetarian also get colon cancer. I have patients like they're vegetarian. We diagnose with cancer. They say, "Why, doctor? I'm a vegetarian. I don't eat any meat. Or why do I get cancer?"
Okay.
Yes.
But are they true vegetarians? Or like what if they only say, that I'm a vegetarian, but
I mean,
actually...
I can't drill them. Are you sure you're a vegetarian? They use a brick to hit my head.
Hey, sorry. Back to our main question. Yeah. So when should one see a doctor if you have like blood in your stool? Yeah.
So you should seek a doctor if the bleeding is persistent. You say that usually pulse bleeding it resolve within say 3-4 days. It stops by itself.
Oh, okay.
Then we're all right. A persistent bleeding, a lot of heavy bleeding. Thirdly, if the pulse itself is causing symptoms like pain until they cannot walk straight.
Can it cause?
Of course
pain?
it can. When sometimes the pulse get what we call thrombose, means that it's blood clot that's stuck inside the pulse. If the pulse have bleeding, it bleed out, you have blood in the stool. Sometimes the bleeding may be within the pulse inside. The pulse get very swollen. It get very painful. Yeah. So those you should seek help. Otherwise, you can't even sit straight. You can't go and poop normally because it's very painful.
Does it affect your sleep?
I mean, pain will affect everyone's sleep, right?
So it means that the pain should be like 24/7 kind of pain.
Yes, it will be quite painful.
Constant kind of like
Constant pain.
ringing pain.
Yes.
In that area.
Yeah.
That sounds
What
like
do
a
you
lot
do?
of pain.
You diagnose pulse.
So we diagnose pulse. It depends whether the pulse again is it that we call acute pulse, meaning the pulse. The problem is like thrombose, got blood clot inside. They're causing a lot of pain. Usually, acutely, we may try to get out of the blood clot, make a small cut, release the blood clot, then the pain get better. Or sometimes we put some special solution at the anus to soothe it, painkiller, and something to string the pulse a bit. And of course, we cover them a lot of painkillers. And we give medication to make sure the stools are soft. Remember, initially we said hard stool make pulse worse.
Yeah.
So we need to break that cycle.
What about surgery? Do you treat pulse with
Yes,
surgery?
we treat pulse with surgery also. So if it doesn't work, next thing is surgery. So surgery for pulse, we usually depends on what stage of the pulse.
Wow,
Pulse,
got
we,
stage
yes,
now.
pulse,
Wow.
yes, stage, yes. So stage of pulse we divide 1, 2, 3, 4. There's 4 stages of pulse. Stage 1 of pulse is pulse. They are within inside the anus. You can't see it.
Okay.
So they have symptoms, mainly bleeding. They say they go toilet, got blood in the stool, but they don't see anything from the anus.
So
Right.
actually, that one you cannot see.
No,
from
yeah,
outside.
yes, you can
Cannot
see.
see from
Cannot see from
Not,
outside.
not like that.
Not like
this
that.
one can see, right?
This is can see. This outside.
Okay.
Right.
So is it normal?
Sometimes some people got a bit of pulse here.
Okay.
So we're talking about the internal pulse.
Internal.
Yes. So stage 2 pulse means the pulse pop up a bit after the pass motion,
Okay.
but it goes in by itself. After you pass motion, it goes in by itself. 3 means pop out. Then it stays there. Then they need your finger to push in. These are patients usually tell us they feel there's a lump at the bum. They'll tell you it's a 20 cent size, 50 cent size. Then they use their finger to push it in. They feel better.
Okay, if it is out,
Then
is it painful?
it can be painful. That's why it's uncomfortable. It get more swollen. Then they come and seek for treatment.
So you push it in?
Patient push it in themselves. They'll tell us the history. Yeah.
Oh.
Because they feel something uncomfortable there. They'll go and press around it and they push it in.
Okay.
Yeah.
Right.
And 4 is all the way outside. Can't be even be pushing.
My goodness.
Yes.
I can't even think about that. Someone gotta put a picture
But
here
why
for people to
is-
see.
You cannot push it.
It's so swollen.
Isn't it soft?
Very swollen. Until too big size, it can't be pushed in. Or stay outside too long, it can't be pushed in.
So it must be painful.
Some are painful, some are not. Because some are outside for very long, it may not be painful.
Do they see a doctor for that?
Yes, they see.
Do patients just live with it and
You are right.
Don't
There
see
is some
it.
patient that live with it. Yeah, they get used to it.
Is that okay? They live with it?
I mean, if they tolerate the symptoms, of course it's okay. Because end of the day, piles are not cancer. Are benign things. So
It's
we operate
benign.
on piles mainly for their symptoms.
Okay.
2 are the main symptoms. 1 is the bleeding. If the always bleeding, profusely, it cannot stop. We need to do something. Correct? 2, the symptoms of the piles itself give them uncomfortable symptoms, be it pain, be it that they feel that it's very uncomfortable. Or every day, pass motion, got lump come out, need to
Okay.
use finger to push. The one
Oh my
we
goodness.
cut it out for them.
can I
Oh.
just ask for stage 4
Yes.
out all the time, right?
Yeah.
Can they pangsai?
Yeah, they can pangsai.
Oh,
Wow.
it's all.
Piles is
Will it like bleed profusely?
Usually the piles is at the corner all around. The sheet still can come out from the center.
Oh.
It doesn't block the hole.
Wow.
So there's a misconception or it's a myth that piles can cause blockage. It will not block your anus.
Oh.
Something can block it. We are more worried. You said that cannot come out. It's a cancer, the growth inside.
Oh, okay. Well, that is.
So if they feel something outside, it can be cancer also, right?
It may be
Not always.
not always piles.
piles.
You are right. It may not always be piles. It can be cancer. Yeah.
Okay.
So got
If it
something.
is cancers, can it be soft like piles? Or
It means cancer.
cancer?
If cancer, then we are a lot more concerned. Then we
No,
need
I
to
mean
do-
from patient point of view. If, let's say stage 3, they push in. But if it is cancer, colorectal cancer, anal cancer, can they push in?
If it's small cancer, it may will push in. It may mimic like piles, but
Okay.
those cases are not common.
Not common.
You mean the
Yeah.
cancer could be somewhere inside
Yeah,
here?
can be somewhere here.
So it's still called colon cancer, right?
So colon cancer usually in medical term is high up.
Higher up.
Here
right?
we call it rectal cancer. Rectum
so it's
is
another-
rectum.
it's another one. It's another term for
but
it.
usually
Rectum
we can
cancer.
just lump it for the layman or public. We just call it any
colon
colorectal
cancer,
cancer
right?
or
Okay,
colon
I see.
cancer.
I
Yes.
see. So it means that
Yeah.
a cancer can form here,
Can form there.
right? And it forms
Yes.
like a blockage here.
Yes, can form blockage.
And that cancer still can spread to the rest of the body.
yes, it can spread.
It
the
still
rest of the
spread. So, but it's somewhere here, lah.
Yes.
So it blocks the motion from traveling.
Yeah. So you can
okay.
imagine there's a cancer here. It may mimic behavior like piles, right?
Okay,
It's
so
a
like
growth here.
somewhere here, somewhere here,
right?
okay.
Like here, there's a
Okay.
cancer here.
Okay.
So cancer, the skin of the cancer is very thin also. So
Yeah.
you
It
bear
can
up,
bleed.
motion, it can cause bleeding.
Yeah.
Also fresh blood, it's like
Okay.
piles.
Okay.
Correct? When no motion, it may stop.
Okay.
Right? So it may mimic, we think the bleeding is from piles, but it may be from cancer. Yeah. The
So-
only difference sometimes, because cancer over time, it may grow. It may have other symptoms. It may have other secretion like your pass motion or the bera got a bit of mucus.
No, my
Mucus,
goodness.
whitish material, or your motion will start to change because it grow bigger and may block the motion coming down. Then your
So
motion
your
become
poo becomes smaller or something.
correct,
okay,
becomes
okay.
smaller and becomes sometimes watery.
Watery.
Then we are
Why
very
watery?
concerned because if you get whole thing blocked, the only way for it come down, it need to become very soft, right? Sometimes small come down, you will become more liquid, then it can come down.
okay.
They go toilet, but they go toilet many times, 6-7 times a day. All these things they make us very worried.
They cannot empty fully.
After they pass motion, still feel got something there, still need to go, but cannot empty it.
Wow,
When
today
you
so
have-
many terms.
Yeah,
When you have
confusing.
rectal cancer, right?
Yeah.
Can you feel like you have poo but never come out.
Yes, you may have that sensation.
constipation.
As I explained, medical term we call it
The
tenesmus.
cancer itself feel like poo.
Okay.
Because it's a lump there. The lump feedback to our body. There is a poo there. Want to puff up, but you poop, it cannot come out. You poop, maybe a little bit of shit come out, but the thing's still there. So you always got this sensation want to poop. So one of the classical symptoms that sometimes patient tell us or the family tell us, my father always go toilet, sit inside for many hours, but nothing much coming out every time, sit there. So we make us worry.
Do they feel like bloated and
they may or may not be blocked? If it get obstruction, they feel blocked.
If they cannot pass motion, pass a little bit, still got left, and they keep eating.
Yeah, then you may get obstruction, get blocked.
I think that begs the question, because like some people do spend hours in, okay, not say hours, like that's an exaggeration, but they spend quite a fair bit of amount of time in the toilet, and then they complain that they did not produce much. But I don't think they have any issue. So means that when does this problem with the transactional flow, when does it turn into a worrying concern?
So usually, like if elderly people come for these type of symptoms, we want to first exclude cancer first.
Okay.
So exclude cancer by doing what we call colonoscopy.
Okay.
We put a long tube with a camera at the tip up the anus to see the whole colon.
Okay.
To make sure that there's no growth anything inside.
Okay.
So if whole colon is clear, which is good news, means nothing cancerous, then it boils down to more we call like functional problem. Meaning sometimes there are coordination of the muscle here.
Muscle area.
All this muscle is not in sync. So they always need to push. Or in Asia here, very common sometimes is because we are trained from young that every time from morning must go toilet to poop.
Okay.
So every time you sit there when there's no motion come out, you go strain. Of course, there's nothing come out. As we age, our motion habit may change.
Talk about the camera going in.
Yes.
Right? Camera going in. Actually, how far can someone's hand, like hand size, can actually go into the anus?
Hand.
Your hand usually
Yeah, like
I don't think the hand go in.
just a
usually
finger.
it's a finger.
It's a
so
finger.
as deep as a finger, like your finger. Come, let's compare. You can go deeper than mine.
Okay. Honestly,
deeper.
let's say the middle finger. Let's say like how long is your middle finger?
We don't use middle finger to check. We use
It's the
index finger.
finger
So
to
we
check.
do this. We go in.
Check.
So this is the maximum we can
Okay.
go.
because like I was once admitted into hospital in Singapore and then like I had some issues with the right side of my stomach. Like it was feeling a bit uncomfortable, and it's like the doctor just like
Come and poke you.
stick her finger right into my butthole. I felt a bit molested.
Not the whole hand.
Not
the
the,
whole
I
hand.
couldn't see it. I was turned aside. So my hand was like here, and then my head was like on the bed. And then the nurse was telling me, stay calm. I'm like, stay calm, your ass, stay calm. I'm being fingered in my butt. Like, almost stay calm.
How long?
How long was that? I don't know. I didn't count. I just felt like
Molested.
I felt molested, bro. I was like, man, this is not supposed to be the way. So is it like one finger just go inside? Like,
One finger.
Just one finger.
Yes, one finger.
And what's the purpose of that? I didn't feel any. I mean,
So the purpose of the we call it digital examination because
Digital examination.
It's called digital.
Wow.
Digital, yes. Or we call it rectal examination. So
Okay.
we put in, we want to feel around here, especially remember just now say if there's a growth here, lower part, we can feel
So
it.
you feel
We feel it.
you
yes,
feel
we
it
anything
inside.
now.
Oh.
Normal should feel smooth.
Oh.
Can you feel pulse also, right?
Pulse
But
is
smooth.
Pulse usually we can't really feel because pulse, remember, is made from blood vessels.
Okay.
You press it, compress in.
Okay.
So we can't really feel pulse per se. If it's outside, we can see it. Pulse, after that, we use this special scope we call protoscope.
Protocols.
Also something as long as my finger, we put it
But
in
bigger,
it.
right? Bigger.
Slightly bigger only.
Wow.
We put in here, we can see the pulse like
Maybe you
coming out.
protoscope.
You want, we can bring out and do for you.
Like right
Check
now.
Yes.
Oh, no. Oh my goodness. Then that's it. I'm gonna call the police.
Live.
It was a live demo.
yeah, but that was a heck of an experience, you know. But you know what solved all the pain? You know, like what solved all the pain when I was in Manila? Because I was in NS
Yes.
at a point, right? And then they brought me to the hospital, right? And then they check my asshole. And you know what solved all the pain? Like the doctor didn't do anything, but they gave a medical certificate.
That's all you're in for.
That is the
Okay.
magic paper, man. That solves all the
info.
pain. Back to pulse.
Shit, huh?
Really? Yeah, actually, in fact, for
Outside.
pulse, right? For what you call hemorrhoid surgery.
Hemorrhoid surgery.
Hemorrhoid surgery. How does that in Chinese?
Chinese we call it 痔疮.
Hemorrhoid surgery.
你可以讲华文对吗？
我可以讲一点华文。
当然可以讲，你可以讲华文吗？
不会讲。
你不能讲。Oh, macam-macam kon. Apa kon?
Jawa aku iso.
Jawa iko iso.
Tapi Mandarin ra iso.
Iso orang iso, kudu iso. Ah, cakep, sedap. Nah, so after a surgery, right? Like what kind of surgery do you actually recommend usually for different types of people?
So surgery for pulse, there's many types.
Oh,
if you read.
wow.
Wow.
So usually pulse surgery, I'll say that patient need to earn the surgery because need to
Earn
be,
the surgery.
in a way, because pulse, remember at first I say it's normal cushion around there. So even after we operate, you still got the cushion. So they need to really make sure that the symptoms is worthwhile to operate. Like big lumps, they want to have it removed or bleeding.
Okay.
So we divide surgeries into first before surgery and normal medication treatment is we can do rubber band ligation.
Okay.
Small pulse.
Rubber band.
Yeah, we can. You can see here.
In the clinic, yeah?
Yeah, in the clinic, we can do it in the clinic. See, the pulse are inside. Like
Okay.
most of the time, say stage 1 or 2, small
Yeah,
pulse
yeah.
inside. We can bend it. We put special rubber band and it tie off so that the string the blood vessel.
Okay.
Then it will minimize the chance of bleeding. So this usually works for symptoms of bleeding.
There's one type.
Yes, that's one type.
Oh, okay, okay.
Easy.
How much MC do you give for that?
That one. I mean, if depends. Sometimes we got strong patient, they don't want any MC. It's okay.
Wow,
2 days,
Wow.
it's all right. We can
What
give
about
up
you?
to
How much MC you want?
yeah,
If you put a rubber band in my ass,
yeah. You want?
I think I want the whole year to be off.
Oh yeah. I
Like
can give you whether your boss apply approve it or tell you no need to come back
actually,
anymore.
in fact, honestly, I think all of us need a vacation
Yeah.
for 6 months, twice a year. Yeah, I need it every single year.
Yes.
Yeah, we all need that, right?
You will be out.
Bye bye.
But it's okay. Singapore, the government takes care of you very well and give you more job. Okay, I shouldn't comment on government. Yeah. Okay. Anyway, so that was one type of
Yes,
surgery.
that's one time. There's not surgery. This is a bedside procedure.
So many names.
Yeah, meaning
Okay.
be done. We are still fully awake.
Wow.
Right. Then the next is surgery itself. Surgery we call it like hemorrhoidectomy. Meaning we imagine this pulse here. We cut it off, excise it.
Exercise.
What excise it? Cut it off.
You chop
Potong it.
off.
Chop off. Yeah.
Chop it off. Okay, so you chop off.
Chop
Then
off,
the second
yeah.
type of surgery, second type of treatment.
Treatment.
Chop off.
Yeah,
Yeah,
chop off.
chop it off.
All right.
Okay, yeah.
The especially got one big one. We just snip it off. Chop it
Okay.
off.
Will it bleed if you just chop it off because it's blood vessel, right?
We will make sure no bleeding. We will stitch up the corner. Make sure there's no bleeding. Yeah. Otherwise,
like
you'll bleed. Yeah.
Sound like a pro.
Yes.
Sound like a pro.
Yeah. Then we got other methods. We can use special stapler. No.
Stapler.
Staple the pulse.
Stapler.
Yes. Yeah.
Have you got stapler
Yeah.
in your...
Get
Staple in
Yeah.
my butthole.
Yes. Inside got one row stapler.
Bro, my butthole in paper, man.
yes.
Hey, I ain't
Yeah.
taking any. That's it.
Inside.
Never mind.
Yeah.
When you tell your patients you will have stapler, what do they say?
Most of the time, after explain to them, they are okay.
How do you explain?
Usually, stapling is we meant for more like the pulse that is all around coming
Okay,
out.
okay.
Staple is one whole round ring inside. We bring the whole pulse going inwards.
So you kind of like you push it.
Push it in, staple inside. Yes.
and you
Staple.
just-
All inside.
Jepret.
Something like chop around.
Cap
So-
here.
Yes,
Like-
all around.
You fix it to the wall.
Something like that. Oh, one round. It's a circular, one round stapler.
Yeah, I think we need to have like a picture on
Pictures,
it, right? Because
yes,
there's some
yes,
picture to
yes.
show
Yeah,
to
how-
show
how it
you
looks like.
guys
Correct.
what is that like. Like it's like a staple.
Stapler, yeah.
Yeah,
Okay.
that's really confusing.
Confusing.
Anything else?
Yeah. What is one more?
Other ways nowadays we can use energy device to burn it off, like to burn off the pulse. Yes.
Wow,
Like using what, RF
you
or-
got rubber band.
Energy. I mean, like we got like medical energy device, like we call it like ligature to burn or seal off the vessels.
Using heat.
Heat technology, yes.
I see.
And many ways to
many ways.
Yeah, many ways.
And
It's
now
a
you
menu.
gotta
One whole
burn the butthole.
yeah, and one whole selection what to do.
Oh,
But
I
usually
can feel the heat.
we'll see what sort of pulse. Is it one area all around? And what stage is it? Then we recommend the best solution for the patient.
Right.
Yeah.
I see.
not
That
one
is-
method suitable for everyone.
Actually, right, talking about technology, by the way, right, one of the hot topics right nowadays about technology is AI. Artificial intelligence. Right? Is there anything that AI can do for this industry, for maybe for you perhaps, for this kind of like surgery? Is there a possibility where we see AI doing this in
Just
the future?
robot.
Yeah, like stuff like that.
For pulse, unfortunately, no, because
Not
it's still
in the future.
manually cut and it's not so complicated. But we do already in use of AI for colonoscopy.
Oh, okay. So
because
they can recognize.
colonoscopy, we maintain to see for before cancer develops.
Yeah.
The pre-cancer stage we call polyps.
Oh.
You know, polyps,
I don't
small
know
growth.
what is that.
Like this one, these are polyps.
Okay.
So polyps are very small and usually it's like 1 mm, 2 mm. So imagine colon is very long. Well, so traditionally we try to hunt for it, look at it carefully, all the whole lining. Now the AI can help us to detect. You light up on the computer screen which area may be polyp, but it still needs us to confirm, look at it. It just guide us, say that you light up this one may be a polyp.
With colonoscopy.
Yes, a colonoscopy.
And it is AI powered.
Yes, yeah.
Okay.
But it's still in early stage. Yeah.
Okay.
Yeah.
So you got some AI going on.
Yes,
Doctor,
AI.
do you do AI?
No. Don't
You don't do AI.
No AI.
No, yeah, yeah.
Yeah, the only AI I know is ChatGPT for now. Yeah, all the
Become your
schooling
doctor.
kids, you gotta use ChatGPT, right? I know. Actually, like I got one thing to ask about it. Like, how long does someone take to recover from
From,
a treatment?
for hemorrhoid surgery.
Yeah. How long does it take to recover?
Okay, so like for just now, the first one, just bending. Next day, normal.
Jabut really.
Cabut. Yeah. In fact,
Okay.
after bending, minimal symptoms, minimal side effect.
Okay.
For surgery, if we need to exercise,
Okay.
definitely there's some pain. If I
Okay.
tell you no pain, lying to you.
Okay.
Usually the pain is worse the first 2-3 days
Okay.
because got open wound there. But we'll cover them with sufficient painkillers.
Okay.
And we give medicine to make sure the motion come down, remain to be soft.
Okay.
Yeah. So after the first week, usually patient feels quite well.
Okay.
But after 2 weeks, most of patient like normal symptoms. Yeah.
Oh, okay.
But after operation, after first day, they can do normal things. Can walk, can sit,
Okay.
can go around. Just a bit of sore at the bum.
Maybe any dietary restrictions on them.
In terms of dietary restriction, we will encourage patient make sure drink enough water, take fibers,
Okay.
and try not to eat spicy things.
Oh.
Imagine you got raw wound, right? You raise a chili to rub your wound, very pain, right? So same thing. The wound, if your chili seed come down there, still
Wait, chili seeds cannot be digested,
it
right?
won't get digested. Yes.
So that can cause what they call, what is this thing, appendix?
No.
I mean, it's a myth, not really proven to cause
okay.
appendix. Yeah.
Again, moms, bear in mind. Yeah. So you don't eat spicy food.
At that period of time, yes.
For some time, don't eat spicy food. So no mala.
No mala.
No mala.
Unless you want your piku to mala.
I don't get it, but yeah, it's funny. Yeah, I don't get it, but I still don't get it. Yeah, but okay. Let's tell all our viewers here. Today we have heard a lot of things, I believe, about the butthole. Yeah. So can you summarize for every one of us here in the room and for everyone out there, what are the main points today that you think are important for them to take away?
I think, in summary, most important is do not let the pulse control your lifestyle. Be the one in control. So seek help early if you got issues with pulse. Do not be shy. We are always here to help you.
And so that's all we have for you today. And together, doctors say one more.